Dr. Emma Stone stood at the nurse's station, looking at patient charts with the careful attention of someone who'd learned never to make guesses. At 34, she was one of the hospital's most experienced trauma surgeons, yet somehow the most alone. 3 years since that night in Kabul. 3 years since she'd been called reckless and dangerous. 3 years of working in the shadows while other doctors got the important cases. "Dr. Stone," the ER resident approached nervously. "We've got an incoming trauma. Multi-car accident. Male patient 32. Massive internal bleeding. ETA 2 minutes. Emma nodded, already moving toward the trauma bay. These were the cases she got now. The desperate ones. The ones where failure was expected. Where her ruined reputation couldn't fall any further. The ambulance doors burst open. Paramedics wheeling in a patient whose vital signs were already going bad. Emma's hands moved automatically. Airway, breathing, circulation. But her mind caught on something familiar about the injury pattern. "Talk to me," she ordered, cutting away the patient's shirt. "Michael Thompson, 32, thrown from vehicle, blunt force trauma to chest and stomach, pressure dropping fast, heart rate climbing. We've lost him twice already." Emma exposed the chest and felt her blood run cold. The injury pattern was unmistakable. Massive heart bruising with fluid around the heart, combined with a shattered breastbone that made traditional surgical approach nearly impossible. She'd seen this exact combination once before in Afghanistan on Sergeant Tim Garcia, the patient she'd tried to save with an experimental battlefield technique. The patient who'd died on her table while she was trying to be innovative. "Get me Dr. Johnson," Emma said, her voice tight. Now. Because this patient was going to die just like Garcia had died, unless she tried again, unless she risked everything on the technique that had destroyed her career. Dr. Mark Johnson, chief of heart surgery, arrived in the trauma bay with his usual air of unquestioned authority. At 60, he'd performed thousands of surgeries and rarely encountered cases he couldn't handle. Until now. "Jesus," he breathed, looking at the X-rays. "Massive heart bruising, fluid around heart, breastbone fracture that makes traditional opening impossible." He turned to Emma. "Options?" Emma felt the weight of 3 years pressing down on her. "Standard approach won't work. The breastbone's too unstable. If we try conventional access, we'll cause more damage than we fix." "Alternative approaches?" "Side chest opening might give us access, but with this degree of heart trauma, we won't have enough exposure to repair everything." Emma's hands were steady, but her mind was racing back to that night in Kabul. Johnson studied the scans, his expression growing grimmer. "Without breastbone access, I don't see how we save this patient." "There might be one way," Emma said quietly. Johnson looked at her sharply. "What way?" Emma hesitated. This was it. The moment she could either stay silent and watch another patient die, or speak up and risk everything on a technique that had already failed once. "A modified under-breastbone approach," she said. "Instead of splitting the breastbone, we access the heart sac through a small window below, then use specialized instruments to repair the heart damage from underneath." Johnson's eyes narrowed. "That's not a standard technique." "No. It was developed for battlefield trauma situations where traditional surgical access was impossible." Emma met his gaze. "I saw it used once in Afghanistan." "You saw it used, or you performed it?" The room went quiet. Everyone knew Emma's history, the brilliant military surgeon who'd come home in disgrace after a failed experimental procedure cost a soldier his life. "I performed it," Emma admitted, "on a patient with this exact injury pattern." "And?" Johnson's voice was hard. And he died on the table. Massive bleeding during the repair attempt. Emma's voice was steady, despite the memories clawing at her. It was ruled an unnecessary risk, an experimental technique that hadn't been properly tested. I was disciplined, and my military medical privileges were taken away. Johnson was silent for a long moment, looking between Emma and the dying patient. So, you're suggesting we try the technique that already killed someone? He said finally. I'm suggesting it's the only option this patient has. Emma pulled up the heart monitor. He's got maybe 20 minutes before permanent damage occurs. Standard approaches won't work. We can either let him die without trying, or attempt something that might save him. Might save him, Johnson repeated. Or might kill him like it killed your last patient. Emma flinched, but held her ground. Dr. Johnson, I've spent 3 years analyzing what went wrong in Afghanistan. I know where the technique failed. I know how to prevent the complications that killed Sergeant Garcia. You know how to prevent them, Johnson's voice dripped with doubt. Based on what? 3 years of thinking about a failure? Based on 3 years of reviewing every detail of that surgery, of understanding the bleeding pattern, of identifying the exact moment where the approach went wrong. Emma's voice grew more intense. Dr. Johnson, I didn't fail because the technique was flawed. I failed because I didn't account for battlefield conditions, the patient's low body temperature, the blood clotting problems from blood loss, the limited lighting. Here in a controlled OR with proper resources, it can work. Johnson studied her for a long moment. Or it can fail again, and we'll both be responsible for this patient's death. He's going to die anyway, Emma said bluntly. His pressure's dropping. His heart's failing. Without intervention, he's got 15 minutes. With standard approaches that won't work, he's got 15 minutes. The only question is whether we're willing to try something that might give him a chance. The monitors started alarming more urgently. Thompson's pressure was falling faster. Dr. Johnson, the resident called out. We need to make a decision now. Johnson looked at the monitors, at the dying patient, at Emma standing there with the weight of her past failure and the desperate hope of redemption. No, he said finally. I won't authorize an experimental technique that's already proven fatal. We'll attempt side chest opening and do the best we can with limited exposure. That won't be enough. It's my decision, Dr. Stone. Johnson's voice was final. Prepare for standard surgical approach. We operate in 5 minutes. As Johnson walked away to scrub in, Emma stood frozen, watching Thompson's vitals continue their downward spiral. She could let it go, follow orders, watch another patient die with the same injuries that had killed Garcia. Or she could fight, risk everything, possibly save a life, or destroy what little remained of her career. The monitors screamed as Thompson's heart began to fail. Emma made her choice. Taking the risk. Dr. Stone, what are you doing? The scrub nurse's voice carried alarm as Emma moved toward the supply cabinet, pulling out specialized instruments that weren't part of the standard surgical tray. Preparing for under-breastbone approach, Emma said, her voice calm despite her racing heart. But Dr. Johnson ordered side chest opening. Dr. Johnson ordered an approach that won't work. Emma met the nurse's eyes. Karen, you've worked with me for 2 years. You know I don't take unnecessary risks. This patient will die with a standard approach. I'm giving him a chance. Karen hesitated, then nodded. What do you need? Long-handled forceps, specialized retractors, fiber optic scope for visualization. Emma's hands moved with practiced efficiency, assembling instruments she hadn't touched in 3 years. And call Dr. Martinez from anesthesia. Tell him I need someone who can handle rapid blood transfusion protocols. Emma, Karen said quietly, using her first name. "If this goes wrong, Johnson will destroy you. If I don't try, I'll have destroyed myself." Emma looked at Thompson, whose vitals were approaching critical levels. 3 years ago, I failed to save a soldier because I wasn't prepared for the complications. I won't make that mistake twice. Dr. Johnson burst through the OR doors, already scrubbed, and froze when he saw Emma's instrument setup. "What the hell is this?" His voice was ice. "Plan B," Emma said calmly. "The side chest opening will fail. We both know it. This is the only approach with a chance of success. I specifically ordered. You ordered an approach that gives this patient a 0% chance of survival." Emma turned to face him fully. "Dr. Johnson, I respect your authority, but I won't stand by and watch someone die when I know a technique that might save them. A technique that already killed someone. A technique that I now understand completely." Emma's voice was steady. "Dr. Johnson, give me 30 minutes. If I can't stabilize him in 30 minutes using the under-breastbone approach, you can take over with any method you choose." Johnson stared at her, rage and uncertainty warring on his face. "If this patient dies, then I take full responsibility. It goes in the record as my decision, my technique, my failure." Emma met his gaze without flinching. "But if he lives, we'll have validated a technique that could save countless trauma patients with injuries that are currently considered unsavable." The monitor's alarms grew more urgent. Thompson was coding. "We're out of time," Emma said. "I need your decision now." Johnson looked at the monitors, at the dying patient, at Emma standing there with 3 years of guilt and determination written on her face. 30 minutes, he said finally. "But I'm observing every step, and if there's even a hint of the complications you had in Afghanistan, I'm taking over immediately." Emma nodded. "Understood." As she positioned herself at the operating table, her hands moving through the familiar motions of surgical preparation, she felt time collapsing. 3 years fell away, and she was back in that field hospital in Kabul, standing over Sergeant Garcia, attempting a technique that would either save his life or end her career. She'd failed then. She'd lost the patient. She'd been branded reckless. But now she understood what had gone wrong. Now she knew how to prevent the catastrophic bleeding that had killed Garcia. The question was, would understanding be enough, or would history repeat itself? "Scalpel," Emma said, her voice steady. And somewhere in the back of her mind, she heard Sergeant Garcia's voice from that last night in Afghanistan. "Doc, don't let them stop you from being great. Sometimes being great means taking risks nobody else will take." She'd taken the risk then, and failed. Now it was time to prove that failure had taught her something. Time to prove that the rebel doctor still had one more miracle in her. The surgery. The scalpel cut through skin with practiced precision, Emma's hands moving with the muscle memory of hundreds of surgeries. But this wasn't just another surgery. This was redemption or damnation wrapped in 30 minutes of surgical time. "Under breastbone access established," she announced, working with controlled urgency. "Karen, I need the fiber optic scope." Dr. Johnson watched from his position opposite her, his expression unreadable, but his attention absolute. Every move Emma made was being judged against the ghost of her past failure. "Dr. Stone," the anesthesiologist called out. "Pressure continuing to drop. We're at 70/40. "Expected," Emma said, threading the scope through the surgical window she'd created. "The fluid around the heart is preventing heart filling. Once I relieve the pressure, we should see improvement." She worked the scope deeper, the monitor showing a bird's eye view of Thompson's damaged heart. The heart sac was tight with accumulated blood. The heart, muscle bruised and struggling. "There," Emma said, identifying the optimal access point. "Heart sac, window 2 centimeters below the breastbone tip. Karen, specialized retractor." As she worked to expose the heart, Emma felt the weight of 3 years lifting slightly. She was back in surgery. Real surgery. The kind that mattered. "Dr. Stone," Johnson said quietly. "The bleeding point. Where is it?" Emma adjusted the scope, searching. This was the critical moment, identifying the bleeding source before attempting repair. In Afghanistan, she'd moved too quickly, tried to repair before fully understanding the injury pattern. "Multiple sources," she said, her voice tight. "Small vessels along the heart bruising, but the main bleeding is from a heart artery tear. Main artery approximately 2 centimeters from the origin." Johnson leaned closer to the monitor. "That's a difficult repair from this angle, but not impossible." Emma's hands were steady as she introduced specialized instruments through the under-breastbone window. The key is stabilizing the heart without causing additional trauma. She worked in silence, the only sounds the beeping monitors and her quiet instructions to Karen. Each movement was deliberate, careful, informed by 3 years of analyzing her past mistake. In Kabul, she'd tried to repair too aggressively. She'd assumed battlefield speed was essential. She'd pushed when she should have been patient. Now, she took her time. Methodical, precise. "Pressure stabilizing," the anesthesiologist reported. 80/50. Johnson's eyebrows rose slightly. Surprise, perhaps, or cautious hope. Emma continued working, repairing the damaged vessels with tiny stitches that would hold without restricting heart function. The technique was working. The approach was sound. Then she saw it. A small vessel tucked behind the primary repair site, showing the telltale pulsation of arterial bleeding. Hidden, easy to miss, exactly like the vessel that had caused Sergeant Garcia's fatal bleeding. "There," she breathed. "That's what I missed." "Missed?" Johnson leaned in. "What are you seeing?" "Secondary bleeding source behind the primary repair." Emma felt cold sweat on her back. "In Afghanistan, I didn't see this until after I'd completed the primary repair. When it became visible, the patient was already unstable, and my attempt to access it caused catastrophic bleeding." She'd found it, the mistake that had killed Garcia, the hidden vessel that had been her downfall. "Can you reach it from your current approach?" Johnson asked. "I think so, but it requires extending the window slightly and working at an angle that's—" Emma paused. "Difficult, high risk of causing additional damage." Johnson was quiet for a moment. "What would you do?" "Secure the primary repairs first, stabilize the patient, then carefully extend access to reach the secondary source." Emma's voice was steady. "Exactly the opposite of what I did 3 years ago." She worked methodically, completing each repair, before moving to the next. No rushing, no assumptions. Each vessel secured, tested, confirmed. "Pressure up to 90/60, the anesthesiologist reported. "Heart rhythm stabilizing." Emma allowed herself a small breath of relief, then focused on the final challenge. The hidden vessel that had killed Garcia. "Dr. Johnson," she said quietly. "This is where I failed before. I'm extending the surgical window now." Johnson nodded. "Proceed." Emma's hands moved with practiced precision, enlarging the access point just enough to reach the problematic vessel. In Kabul, she'd been too aggressive here, caused tearing, created bleeding she couldn't control. Now she was careful, patient, respectful of the delicate tissues. "There," she said, finally exposing the vessel fully. "Arterial bleeder, easily accessible now." "Impressive," Johnson said quietly. "I see why you couldn't reach this with standard approaches." Emma placed the final stitch, securing the vessel that had haunted her dreams for 3 years. "Repair complete," she announced. "All bleeding sources controlled." The monitors showed Thompson's vitals steadily improving, heart rate normalizing, pressure climbing toward acceptable ranges, heart rhythm strong and regular. "My God," the anesthesiologist breathed. "It's working." Emma stepped back from the table, suddenly exhausted. "Dr. Johnson, would you like to close?" Johnson looked at her for a long moment. "You finish what you started, Dr. Stone." As Emma completed the closure, her hands steady despite the emotional storm inside her, she realized something profound had just happened. She'd faced her failure, confronted the technique that had destroyed her career. And this time, she'd succeeded. Sergeant Garcia was still gone. Nothing could change that. But Michael Thompson was alive, and that meant something. It meant she wasn't a failure. It meant the technique worked. It meant 3 years of exile and guilt hadn't been for nothing. "Surgery complete," Emma said, stripping off her gloves. "Patient stable?" Johnson nodded slowly. "Well done, Dr. Stone. That was remarkable." As they left the OR, Emma felt something she hadn't felt in 3 years. Hope. Recovery and consequences. Michael Thompson opened his eyes 6 hours post-surgery, his vitals strong, his prognosis suddenly transformed from terminal to excellent. Emma stood by his bedside, reviewing his charts when his gaze focused on her. "You're the doctor who saved me," he said, his voice rough but clear. "I'm one of them," Emma replied carefully. "How are you feeling?" "Like I got hit by a truck, but alive." Thompson managed a weak smile. "The nurse said I had injuries that should have killed me, that you did some kind of experimental procedure." Emma hesitated. "I used a technique that's not widely practiced. It was necessary given your specific injuries." "Experimental," Thompson repeated. "Sounds risky." "It was." Emma met his eyes. "But it was also your only chance." Before Thompson could respond, Dr. Johnson entered with 3 other senior surgeons, the hospital's medical review board, Emma realized with sinking certainty. "Dr. Stone," Johnson said formally, "we need to discuss your unauthorized use of an unvalidated surgical technique." Emma had known this was coming. Success didn't erase the fact that she'd defied direct orders and performed a procedure that had previously resulted in patient death. "Of course, Dr. Johnson." In the conference room, the review board sat across from her like judges at a trial. Dr. Maria Lopez, head of surgical quality, Dr. Robert Kim, chief of medical staff, Dr. Susan Wright, hospital risk management, and Dr. Johnson, whose expression was carefully neutral. "Dr. Stone," Dr. Lopez began, "we've reviewed the surgical records from Mr. Thompson's case. You performed an under-breastbone heart repair using a technique that's not part of our hospital's approved protocols." "That's correct," Emma said. "A technique," Dr. Kim added, "that resulted in patient death when you attempted it 3 years ago in a military setting." "Also correct," Emma kept her voice steady. "I was disciplined by the military medical board and lost my field surgical privileges as a result." Dr. Wright leaned forward. "Yet you chose to use this same technique here, defying Dr. Johnson's direct order to use a standard approach." "I did," Emma looked at each of them, "because the standard approach would have failed. Mr. Thompson's injuries made traditional surgical access impossible. The under-breastbone technique was his only chance of survival. "But you couldn't have known it would work," Dr. Lopez pressed. "Given your previous failure." "I knew exactly why it failed before," Emma interrupted. "I spent 3 years analyzing that surgery, identifying the precise moment where complications occurred. The technique itself was sound. I'd simply missed a secondary bleeding source that became critical during recovery." She pulled out her tablet, displayed the detailed analysis she'd compiled over 3 years. Surgical diagrams, bleeding patterns, biomechanical models of heart trauma repair. "This," Emma said, "is why I was confident. Not because I was reckless, but because I understood my failure completely and knew how to prevent it." Dr. Johnson spoke for the first time. "The board needs to understand something. I observed Dr. Stone's entire procedure. Her technique was flawless. Her judgment was sound. And most importantly, she identified and corrected the exact complication that caused her previous failure." The room was silent for a moment. "Dr. Johnson," Dr. Lopez said carefully, "are you saying you support Dr. Stone's decision to defy your direct order?" "I'm saying she saved a patient I'd given up on." Johnson's voice was firm. "I'm saying she demonstrated surgical innovation and courage that most doctors never develop. And I'm saying that if we punish doctors for succeeding where standard protocols fail, we'll never advance medical science, Doctor." Kim studied Emma. "Dr. Stone, if we validate this technique, if we add it to our protocols, can you teach it? Can you ensure other surgeons can perform it safely?" Emma felt her heart racing. This wasn't punishment. This was opportunity. "Yes," she said. "I can develop training protocols, simulation exercises, guidelines for patient selection. I can make sure that what happened in Afghanistan never happens again. Not because we avoid the technique, but because we perfect it." The board members exchanged looks. "We'll need detailed documentation," Dr. Lopez said. "Complete analysis of both your previous failure and your current success, peer review, validation studies." "You'll have everything you need," Emma promised. "Then here's our decision," Dr. Wright said. "You're not being disciplined for your actions with Mr. Thompson. Instead, you're being assigned to develop a comprehensive protocol for under-breastbone heart repair with the goal of adding it to our hospital's approved procedures." Emma felt 3 years of weight lifting from her shoulders. "Thank you." "Don't thank us yet," Dr. Johnson said with a slight smile. "You just volunteered to prove that your technique works consistently, not just once. That means research, documentation, training, and your first student will be me." As Emma left the conference room, she realized something profound had shifted. She wasn't the rebel doctor anymore. She was the innovator, the pioneer. 3 years ago, she'd failed. Today, she'd succeeded. Tomorrow, she'd teach others how to save lives that were currently considered unsavable. Sergeant Garcia was still gone, but his death hadn't been meaningless. It had taught her how to save Michael Thompson and countless others to come. Building something new. 3 months later, Emma stood in the hospital's simulation lab, watching Dr. Johnson practice the under-breastbone approach on an advanced surgical mannequin. Around them, 6 other surgeons waited their turn, the first group of doctors learning the technique that had been Emma's redemption. "Angle the retractor more upward," Emma instructed. "You need clear visualization of the back heart surface to identify secondary bleeding sources." Johnson adjusted his approach, the fiber optic monitor showing improved access. "Like this? Perfect. Now you can see the vessel that would have been hidden with standard positioning." Over the past 3 months, Emma had worked tirelessly to develop comprehensive training protocols. She'd created surgical simulation scenarios, written detailed technical manuals, consulted with heart specialists nationwide. The under-breastbone technique was becoming validated, recognized, accepted. Dr. Stone, Dr. Maria Lopez, entered the lab. "I have news. The Journal of Trauma Surgery accepted your paper. It'll be published next month as the lead article." Emma felt a surge of pride. Her detailed analysis of the Afghanistan failure and the Thompson success had been peer-reviewed and validated by the top trauma journal in the country. "There's more," Lopez continued. "Walter Reed Medical Center called. They want you to present the technique to their military surgical team. Apparently, field medics are encountering these injuries regularly, but have no good treatment options." Emma's throat tightened. Walter Reed, the heart of military medicine, the place where her career had effectively ended 3 years ago. They want me to teach military surgeons? They want the doctor who turned a battlefield failure into a civilian breakthrough to come home and share what she learned. Lopez smiled. "Emma, you're being invited back, not as the doctor who failed, but as the innovator who succeeded." After Lopez left, Emma stood alone in the simulation lab, surrounded by the equipment she'd used to perfect her technique. On the wall, she'd posted a photo. Sergeant Tim Garcia in his uniform, smiling, alive, taken 2 days before the attack that had killed him. "I figured it out, Sergeant," she said quietly to the photo. "Took me 3 years, but I figured out what went wrong, and now I'm going to make sure no other doctor makes the same mistake." Her phone buzzed. Message from Michael Thompson. "Doc, 6-month checkup came back perfect. Cardiologist says my heart function is completely normal. You gave me my life back. Thank you." Emma smiled. Typed back. "You gave me something, too. The chance to prove that failure isn't final. Keep taking care of yourself." Dr. Johnson found her still standing there when he finished his simulation run. "Thinking about Walter Reed?" "Thinking about everything," Emma admitted. 3 months ago, I was the doctor nobody trusted, the rebel who'd killed a patient with experimental techniques. Now I'm being asked to teach at the most prestigious military hospital in the country." "You earned it," Johnson said. "Not by succeeding once, but by learning from failure so completely that success became inevitable." Johnson paused. "Emma, can I ask you something? When you were standing over Thompson, knowing you were about to try the technique that had already failed once, were you afraid?" "Terrified," Emma said honestly. "But I was more afraid of not trying, of letting someone die when I knew a way that might save them." "That's what separates good doctors from great ones," Johnson said. "Good doctors follow protocols and minimize risk. Great doctors take calculated risks when lives hang in the balance. You're great, Emma. You always were. It just took you 3 years to prove it to yourself." After Johnson left, Emma began preparing her presentation for Walter Reed. She'd tell them about Sergeant Garcia, about the failure that had destroyed her confidence, about the 3 years of analysis and doubt, about Michael Thompson and the second chance that had changed everything. But most importantly, she'd teach them the technique, the under-breastbone approach that could save soldiers with injuries currently considered fatal. She'd turn her greatest failure into her greatest contribution to military medicine. "This one's for you, Sergeant," Emma said to the photo, beginning her work. "Because some failures are really just lessons waiting to be learned. Some endings are really just beginnings in disguise, and sometimes the rebel doctor is exactly what medicine needs, someone willing to risk everything to save lives nobody else can save." Return to Walter Reed. 6 months after Thompson's surgery, Emma stood in the main auditorium at Walter Reed Medical Center, looking out at an audience of over 300 military medical professionals. Surgeons, field medics, trauma specialists, medical commanders, all gathered to learn from the doctor who'd once been drummed out of military medicine. 3 years ago, Emma began, I stood in a field hospital in Kabul trying to save Sergeant Tim Garcia. He had massive heart trauma, and I attempted an experimental under-breastbone repair technique. She clicked to a slide showing Garcia's smiling photo. Sergeant Garcia died on my operating table. The technique failed, and I was ruled unfit for military surgical practice. The audience was silent, attentive. For 3 years, I carried that failure. I questioned every decision I'd made. I wondered if I'd been reckless, dangerous, unworthy of the trust patients placed in me. Emma's voice was steady. But I also spent those 3 years analyzing what went wrong, not to excuse myself, but to understand completely. She clicked through slides showing detailed surgical diagrams. What I discovered was that the technique itself was sound. My execution was the problem. I'd missed a secondary bleeding source, hadn't accounted for battlefield conditions affecting blood clotting, had rushed when patience was required. Another click. Michael Thompson's before and after scans. 6 months ago, I faced the same injury pattern, same impossible anatomy, same technique required. But this time, I knew what had killed Sergeant Garcia. I knew how to prevent those complications. She walked through the entire Thompson surgery, highlighting each decision point, each moment where her 3 years of analysis had informed her approach. The under-breastbone technique saved Michael Thompson's life. But more importantly, it validated what I had learned from failure. Sergeant Garcia's death taught me how to save lives. I just needed 3 years to fully understand the lesson. Emma paused, looking at the military medical professionals who'd once been her colleagues. I'm here today not to glorify failure, but to show you that failure can be the greatest teacher we have if we're brave enough to learn from it. The next hour was technical. Detailed surgical demonstrations, training protocols, patient selection criteria. Emma had prepared comprehensive materials, but the real message was simpler. Learn from mistakes. Adapt techniques. Never stop questioning. During the break, a young Army surgeon approached. Captain Lisa Williams, fresh from her first deployment. Dr. Stone, I lost a patient last month. Similar injuries to what you described. I tried everything I knew, but nothing worked. Her voice was tight with emotion. They're reviewing my case, questioning my decisions. I feel like my career is over. Emma saw herself in the young captain's eyes. The guilt, the self-doubt, the fear of being labeled incompetent. Captain Williams, your career isn't over. It's being tested. The question is, will you let this failure define you, or will you use it to become a better surgeon? Emma handed her a card. Call me. I'll help you analyze what happened, understand what went wrong, and make sure you learn everything possible from this experience. Williams's eyes filled with tears. You do that? After everything you went through? Especially because of everything I went through, Emma said. I spent 3 years alone with my failure. I won't let another military surgeon go through that if I can help. The afternoon session focused on hands-on training. Emma had brought surgical simulation equipment, allowing the military doctors to practice the under-breastbone technique in realistic scenarios. The key, she instructed, watching a field surgeon work through the procedure, is patience. In combat zones, we're trained to work fast, but this technique requires methodical precision. Speed comes with practice, but accuracy must come first. By the end of the day, 12 military surgeons had successfully completed the simulated procedure. 12 more doctors who could save lives in situations previously considered hopeless. As the conference concluded, Colonel James Patterson, chief of military surgical services, approached Emma. "Dr. Stone, I was on the board that reviewed your case 3 years ago. I voted to revoke your field privileges." He extended his hand. "I was wrong, and I'm sorry." Emma shook his hand, surprised. "Colonel, you did what you thought was right, given the information you had." "No," Patterson's voice was firm. "You did exactly what military doctors are supposed to do. You innovated under pressure to save a soldier's life. The fact that Sergeant Garcia didn't survive doesn't change the courage of your attempt. We failed you, Dr. Stone. We punished innovation instead of learning from it. Today, you taught us that lesson. Thank you." After Patterson left, Emma stood alone in the empty auditorium, looking at the photo of Sergeant Garcia, still displayed on the main screen. "We did it, Sergeant," she said softly. "Your death wasn't meaningless. Today, 12 doctors learned how to save soldiers with your injuries. In 6 months, maybe 50 more. In a year, maybe hundreds." Her phone buzzed. Message from the Medical Review Board. "Dr. Stone, we're offering you a consulting position with Military Medical Services, part-time advisory role, helping develop innovative combat medical techniques. Interested?" Emma smiled. 3 years ago, they'd thrown her out. Now they were asking her to come back, not as a field surgeon, but as an innovator, a teacher, a bridge between military and civilian medicine. She typed her response. "Interested. Let's discuss terms. Because some stories don't end with failure. Some stories use failure as the foundation for something greater." Sergeant Garcia was still gone. That would never change. But his death had taught Emma how to save countless others, and that was a legacy worth building on. 1 year later, 1 year after Thompson's surgery, Emma stood in her new office at the Institute for Advanced Trauma Surgery, a collaborative center she'd founded between Walter Reed and Metropolitan Hospital. The walls were covered with photos: Sergeant Garcia, Michael Thompson, and the 43 patients who'd been saved using the under-breastbone technique in the past 12 months. "Dr. Stone," her assistant knocked. "You have visitors." Michael Thompson entered, walking strongly, looking healthy. Behind him was a woman Emma didn't recognize, and a young girl about 8 years old. "Dr. Stone," Thompson smiled broadly. "I wanted you to meet my wife Emily and my daughter Sophie. Sophie, this is the doctor who saved Daddy's life." The little girl looked at Emma with wide eyes. "Daddy said you did a magic surgery that other doctors couldn't do." Emma knelt to Sophie's level. "Not magic, sweetheart. Just medicine that required trying something new. Your daddy's heart was hurt very badly, but we found a way to fix it." "Daddy says you're a hero," Sophie said seriously. Emma felt her throat tighten. "Your daddy's the hero. He fought very hard to stay alive." After they left, Emma stood at her window, looking out at the hospital where Thompson had nearly died, where she'd risked everything on a technique that had already failed once. Dr. Johnson entered without knocking, a privilege of friendship earned over the past year. "Still thinking about that day?" he asked. "Always," Emma admitted. "It was the scariest moment of my career. Standing over Thompson, knowing I was about to try the technique that killed Garcia, wondering if I'd learned enough to prevent history from repeating." "You know what the real courage was?" Johnson sat down. "Not that you tried the technique. Any reckless doctor might have done that. The real courage was that you'd learned from your failure so completely that you could trust yourself to try again." Emma nodded slowly. "I spent 3 years terrified of making the same mistake twice. But I realized that the only way to honor Garcia's death was to learn from it, to become the surgeon who could succeed where I'd failed." And you did more than succeed, Johnson gestured to the photos on the wall. You created a legacy. 43 patients saved, 57 surgeons trained, a technique that's now being taught in medical schools nationwide. It's not about the numbers, Emma said. It's about the little girl who still has her father, about Captain Williams, who I've been mentoring, who just successfully performed the technique for the first time, about turning the worst moment of my life into something that helps others. Her phone rang. Captain Williams. Dr. Stone, I just saved my first patient using the underbreastbone approach. Female soldier, roadside bomb blast, heart trauma. I saw the secondary bleeding source this time. I remembered everything you taught me. Williams's voice was happy and relieved. She's going to make it. That's wonderful, Lisa. You did great. I did what you taught me. I learned from my failure, and I used that knowledge to save a life. Williams paused. Dr. Stone, thank you for not letting me give up on myself, for showing me that failure isn't the end. After hanging up, Emma felt something settle inside her. Peace, perhaps, or acceptance, or simply the understanding that some journeys require detours through darkness before reaching light. Dr. Johnson, she said, remember when you told me there was no hope? When you'd given up on Thompson? I remember. I've been thinking about that moment, about how hope isn't about odds or statistics or conventional wisdom. Hope is about being willing to try something that might not work, because the alternative is accepting defeat. Emma smiled. You taught me that, by letting me try even though you thought I'd fail. Johnson stood. I didn't let you try because I thought you'd succeed. I let you try because I saw a doctor who'd learned from failure so thoroughly that she deserved a second chance. And you proved that second chances matter. As Johnson left, Emma returned to her computer where she was writing a new paper. From battlefield failure to clinical success, the evolution of underbreastbone heart repair. In it, she detailed everything. Garcia's death, her 3 years of analysis, Thompson's salvation, and the 43 patients who'd benefited since. She didn't hide the failure. She celebrated the learning. Because that was the real story. Not that she'd failed once and succeeded later, but that she'd failed, learned, adapted, and transformed catastrophe into innovation. Her office door opened again. This time, it was Thompson alone. Forgot to give you this, he said, handing her an envelope. Inside was a photo. Thompson with Emily and Sophie, all smiling, healthy, alive. On the back, handwritten, to Dr. Stone, who gave me the chance to be a father again. Thank you for not giving up hope. Michael. Emma placed the photo on her wall, right next to Sergeant Garcia's picture. 2 men. One had died despite her best efforts. One had lived because she'd learned from that death. Together, they told the complete story of Dr. Emma Stone, the rebel doctor who'd turned failure into wisdom, defeat into victory, despair into hope. There's no hope, the chief surgeon had said. I still know a way, she'd replied. And in that moment of defiance, of courage, of willingness to risk everything on knowledge earned through failure, she'd saved a life. Not just Michael Thompson's life, but her own as well, because sometimes saving others is how we save ourselves. And sometimes the rebel doctor is exactly what medicine needs. Someone brave enough to try again, smart enough to learn from failure, and compassionate enough to turn tragedy into triumph. One life at a time, one lesson at a time, one second chance at a time. That was the legacy of Dr. Emma Stone. and it had started with a simple declaration: I still know a way.